they follow the guidelines to the core. Okay. So we need to follow what is given in the guideline, what is given in the protocol. So there will always be a step 1, step 2, step 3, step 4 to manage a particular case. Okay. So let's go ahead and look at what are the crucial dates for part 2. Um, the exam is scheduled for 15th of January 2026. Expression of interest closes on Friday, 9th September. Booking window opens on 21st October. Booking window closes on 9th December. Exam date, as they said, 15th January, and results will be released on 11th of February. Another thing I want to make you all understand is that as you all prepare, you all can you all can judge depending on your preparation. Would you, if you want to give it in January or you want to give it in July? That is completely a personal choice, because each and every one is in a different different state in their life, in a different like they might have more responsibility, someone might not have more responsibility, so the amount of time you put every day would be different. So do not compare each other's journey, and we are here to guide you. If you all want any help with your schedule, any help with reading, and any tips, our backend team is here to talk to you. Okay. We would have a moderator who would be with you throughout as well. She's our mentor, Dr. Sana, and she would also be there throughout all the Telegram discussions and to help you solve your doubts. And another tip is that if you all are doing the January session, if you all decide to do it, book immediately the day the booking window opens, because in the end you don't get seats that you would want. Okay, if you live in a particular city, that city seats would maybe get over faster. For example, in Mumbai, the seats get over in like a jiffy, so you have to be really fast to book it. Okay. Another thing that you have to understand, that this is not a it's not a sprint, it's a marathon. Okay, so you need to do it slowly. You can't be like, oh my god, I'm going to study 10 GTGs in a day. That does not happen. You need to have a schedule in your head. You need to go step by step. So for that, you have to set clear goals, first of all. Second is, you can take breaks. You need breaks. Any person, any human would. So you have to have a schedule, and you need to incorporate breaks in it as well. Reward yourself, don't put yourself down, because when I remember when I first began my journey for part 2, like a couple of years ago, there was there I when I was beginning, I had already cleared my masters, and I was wondering, why are my questions going wrong? That's completely okay. Our brain isn't trained to think the way the people practicing in the UK, or the people who've trained under the college think, and we need to train ourselves to think that way. And for that, we need to read the guidelines. Correct. We've read our textbooks, whichever ones are in use in our respective countries, and our mind thinks in that way, or our mind thinks in the way our parent institute works. But that is not the case for this exam. You have to think according to the protocol and according to the guideline. I hope I'm making myself clear, guys. Next thing that you need to know is that you stay positive and surround yourself with motivation. You all can have study partners. We all will have mentors, and you all will have our team support as well. And there's always no harm in contacting or getting in touch with other people who are also preparing for the exam. Now, another thing that we have in our mind, like when I began, I was like, I did not know what to read. And I almost wasted a month of my preparation as to know what I had to read. So first of all, what is the study material? Study material, firstly, would be that all of this is available on the website of RCOG. Most of it is free, except for articles from the obstetrician and gynecologist, which is a journal by the college, and it has paid reviewed articles. So it's a paid journal. So it's not really accessible to everyone unless you are a RCOG member or a RCOG associate member, or you have access through your institute. Okay. So we will be providing you those articles as well. We will be providing summaries of the articles. Next is how to manage the content. As I said earlier, it's an ocean, and you need to pick out the pearls out of it, because we cannot completely study the ocean. Okay, it's vast. So we need to pick up what's important, what is high yielding, and then learn it and revise it. What's in paper 1 and paper 2? So as you all had in part 1, this 2 again has paper 1 and paper 2. So it usually begins as SBA of obstetrics, followed by EMQs of gynecology. In the second half of the exam, it could be SBAs of gynecology and EMQs of obstetrics. This can be interchangeable, but this is most of the time this pattern is followed. Okay. How will I manage with job? Again, as I said, for this, I think most of us would be working, and even I was working when I was preparing for it. And I also had on-call duties, and it becomes difficult to manage. But what y'all can do is that y'all can make a schedule. To make a schedule, the most important thing is you write down what y'all want to do in a day or in a week and try to achieve it. Okay. How many EMQs practice is needed? Again, as I said, EMQs is something that we would want you all to concentrate, but we would be mainly want to cover the, in the first 3 months, we'll be doing mainly theory and the SBS. So you all get in the limbo of solving the questions and thinking like how they think. And then we would slowly transition into EMQ practice. Still, we would be providing you all EMQs in the lectures that we provide, and I have an example of an EMQ in this session as well. So you all need to start training your mind to think in a particular way to solve the EMQs. Okay. Another thing important is to have a good speed of reading English as well, because the EMQs sometimes would take a lot of time to read in itself, and that is why sometimes the paper, some students have given a feedback that it's lengthy. So I would also say that with concentration, read the question stem. How much do we have to go in detail? As I said, every GTG, every guideline will have a summary. The GTGs already, like the older versions, do have an executive summary. The newer pattern does not always have an executive summary, but they sometimes do have a box. You all can read that, but the first read should always be the whole guideline. Now, I will be talking about that as well, and I'm going to show you all a guideline also on the web page, so you'll understand how to read it. Next is how many percentages is passing. Again, this is something that is dynamic, because it is compared to the particular students giving in that exam. So there's no 50% is passing or 60% is passing. There's nothing like that. Every exam has a different passing. Okay, like my exam had a 65% passing. Okay, and then people scoring higher than that did pass. Okay, another thing is that there are 4 sessions. It is not necessary that you need to clear all sessions, all I wouldn't say sessions, the parts, but your overall has to be passing. Okay, will I be able to do it? Everybody's going to question it. I questioned it even the day before the exam. What am I doing? I'm not even prepared to give the exam, but it's a gamble, and you all are here today, so you all are ready to take the gamble. And if you all believe in yourself, then you all will be able to do it. How much time is required? Again, it's a question that I've answered. It is based on the amount of time you can give for your study, for your making your notes, for solving your questions. Someone who's free right now can just sit at home and do it. Someone who's working, who has familial responsibilities, it's your choice. But we as a team are here to help you and to guide in your doubts. Okay. Again, difficulty, as I've already said, I wouldn't call it fears. They are fears, but you need to accept those fears, that okay, that this exists, because once we are a bit fearful of something, we work more hard towards it. Okay. So yes, it's an expensive exam. Yes, it's a difficult exam. Yes, we are going to have, there are 100 sources for getting your material to study, but you need to stick to one, and you need to have your notes or the notes that we are giving you, and you need to read them and revise them. Time management is key. You need to have a timetable, or you at least need to make up a mind that I will complete this amount of studying in this period of time. Okay. Again, as I said, familiar responsibilities, you can take help of your family. You can, you're going to have to talk to them that, yes, I will have some amount of time that I'll be studying. Again, workload, we all are, some of you are consultants, or you'll have hospitals to run. So it becomes difficult, but we can do it if we incorporate your time. Even if you'll start giving so this is early on, right? If you're planning for Jan, we almost have half a year left. So right now, if you'll even start giving 2 hours in a day to read, because trust me, when you first start reading, you all will take time to understand the GTG. Do not feel disheartened. Do not give up. Just read and make notes or highlight in your GTG. Those of you who you all of you who use electronic, like the tablets or the iPads to make notes, you all can do that, or you all can print it out and read it. Another important thing that I want to tell you all is, when you all have a study corner, there are a lot of numbers as well in this exam as well. Some difficult tables that you all have to know, some doses. You all can print it out or write it down and stick it on your study wall. There has to be a study wall, because visual memory helps even at the last minute to answer a question. Okay. I've already told you all this. Your mindset is important. Baby steps is important, and keep moving forward is what is should be the motto. Exam structure is a computer-based test. 50%, each paper is worth almost 50% of the total marks. However, 40% is single best answers, and I said 60% is extended match questions. 50 SBS, 50 AMQs, 50 SBS, 50 AMQs. You'll have 3 hours, and 1 hour of a break in the middle for lunch. Time management is again 70% should be given to SPA. 70 minutes is given to SBAs because y'all can read faster. Okay, because it's a smaller question to answer. However, as I told you all, EMQs take time to read in itself, right? Because you all have like 20 options or 10 options given and you need to choose the right one. Okay. Modules that we will be covering would be clinical skills, teaching and appraisal and assessment, clinical governance research, which would include statistics as well, ethics and legal issues, because we want to know what is, they have different rules like the Montgomery ruling, the Caldecott principle. All of this would be taught to you all eventually in the lectures. Post-operative care, surgical procedures. The obstetric parts is mainly antenatal care, maternal medicine, labor delivery, and postpartum problems. Gynecological problems, subfertility, infections, early pregnancy care, gynecological oncology, and urogynecology. They give a lot of importance to screening. So cervical cancer screening is something that is you should always expect in your exam. Another thing that they give a lot of importance to is labor. So labor and delivery is something that is important. This exam also surprisingly, the last one had a lot of visual questions. That means they had almost 5 to 6 CTGs, that is cardiotopographies, that were given to them, and that is not something that is usually expected, because you get like 1 or 2 questions which are visual till now, right? However, this time we will also be incorporating more picture based questions for you all, so that you all are well prepared. If they come, it's good. If they don't, you all are still well prepared to handle scenarios in real life as well. Okay. We know that majority of the questions come from Green Top guidelines. Now, Green Top guidelines are basically guidelines which are published by the Royal College, and they are updated at particular periods of time. They are evidence based, and they usually follow these guidelines to manage patients. Now, if you all want to know how to read them, you all can go to Google, write Green Top Guidelines RCOG. You will directly be, directed to their page. In that page, you can find Green Top Guidelines, and they are given year-wise as well. So you all would find the ones published in 2025, like the ones on twins, the chickenpox update, all of that you all will find if you see 2024, 2025, or they also have subject-wise as well. Okay. Or then we have the NICE guidelines, which is National Institute of Clinical Excellence. Then the TOGS, as I said, the review articles are the important ones amongst them. The FSRH guidelines, the FIGO guidelines, the NHS colposcopy guidelines are the ones they follow for screening. Consent advices. Strategy was an older material that was used by the college. Now they have transformed it into a different clinical module, and that is also available to learn, but it's again a paid thing. ESHO guidelines and EMBRACE guidelines. Okay. Another important thing is the FSRH guidelines will tell us about the contraception and the infections. FIGO, and we know FIGO is mainly for malignancies. They have a British Society as well for gynecological malignancies. And we have ESHRE, that is the European Society, that will mainly deal with endometriosis, infertility, recurrent pregnancy loss. EMBRACE is again a guideline, and it's an organization which gives guidelines and reports and updates. Our main, our main aim is to conquer these first. Okay. And obviously these would come in appropriate modules. Okay. Mantra of success, as I said, you listen to the lectures, you read, you make your own notes, solve the questions, and you revise. This cycle is a must, because if you just listen and don't read, there's no point. If you just listen, you don't solve questions, you do all of this. Okay, you have your beautiful notes, but you don't have the time to solve questions, or you've not had the opportunity to solve questions. This cycle is null and void. Because once you follow this whole cycle, you all will be able to conquer not only this, but any exam. Okay. As I said, small steps to the top. And for that, we have highlighted high yield topics and high yield modules. The way we've divided our modules is that we have divided it in smaller parts so that it's easier for you all to learn. They are not in, so for example, like infections would come in maternal medicine or in antenatal care, because there's no different. So these are core modules which you will find on the RCOG website for their training. So it's the same modules, but we've just made it smaller so it's easier for you all to learn. Now this is one of the guidelines that we want to begin with. One of the modules that we would want to begin with, and that's the gynecology module. This is general gynecology. Here we have premenstrual syndrome, for example. That's a GTG, chronic pelvic pain, and heavy menstrual bleeding. Okay. So this is something that you all have to start reading and start giving time, because once you read it the first time, you all might not retain more than 20 to 30% of what's given, unless you have already read it once before while you were preparing for your master or something like that. Now, for example, I had read the nausea vomiting guideline. It's updated now. So when I was reading it for my preparation as for masters, the second time I read it for part 2, it was easier to understand. So this highlights the importance of repeated reading. In the first go, if you're brilliant, you can maybe you can retain it. However, if you're average like me, you would need another read or another read, and that's completely fine. Okay. So this is an example of the module that we I'm sorry, of um the schedule that we have prepared. This is just the gynecological module. The whole mini schedule will obviously be shared in the premium group, and you all can go through that. um Another thing is to how to start studying notes, start studying for part 2. Now this thing I have already told all at the beginning, and I just want to reiterate it by saying that you have to make good notes. Handwritten is something like I was used to, but if you all are more into screenshotting it, or printing it out and highlighting it, and that's your own style. So you all can completely do how you all have been doing it in the past, but notes is important. Don't get overwhelmed. So another thing is that when we read something for the first time, we will shallowly understand it. It's not possible that you're going to understand the whole green top guideline 100%, because there will obviously be nuances, right? In the first go. Maybe you read it for the second time, you'll understand it much better. But we don't waste your time on one guideline for too long. Don't go into 100% depth, because no one will be able to reach that. It's dynamic, it keeps on changing. If you read the guideline, they'll tell you if this is the recommendation. Okay, I'll show it to you all. If there's a recommendation, and below that they have text which is not bold, wherein they will quote meta analysis and references saying, okay, this says this person, this says this person. That is not needed for you all. Okay, because you are not going to be quoting meta-analysis in your exam. They will be wanting to know what guideline they have, I'm sorry, what recommendation they have given, and you need to follow that recommendation. How they came to that recommendation is what they give in the part below the bold text, and that's not really necessary most of the times. If it is necessary, we have already highlighted it in the lectures. I hope I'm making sense to all of you. Again, as I said, stepwise protocols is important. They have a PPH protocol. Okay, it follows a particular step. Now we know we have to give misoprostol, we know we give Trenexa, we know we give carboprost, but they have a certain way of doing it. And you would have questions that, okay, they've emptied the bladder, rubbed up the fundus, now what to do next? Okay, so here you can't answer the misoprostol. Their first line would be oxytocin. So you need to answer it as oxytocin, because they will give you all the options. They'll give you misoprostol, and all the correct doses they'll give you, or they'll give you 10 doses and one dose could be correct out of that. So you need to know what step is next, and you need to know the correct dose as well. Now this is needed for high yielding ones, like for example PPH, or for how much dose of acyclovir you'll give in herpes or in chickenpox. All of that you need to know. You don't need to know, like for example in malaria, you all have a huge table which is given 100 doses. That table needs to be printed and stuck on your wall, because it is something that you would want to know. For same goes for pelvic inflammatory disease. Okay, so you all need to pick up what is what you all find is difficult to retain, and start having visual memory of it, either in the form of making a file of all of these printouts, or having a wall where you all stick this. Okay, or a folder in your iPad, or however, and you wake up and you look at these tables every day for 15 minutes in the morning, or 15 minutes before you sleep at night. Morning is preferable, because you're fresh, your brain can retain more. Okay. Okay, so as I said, recommendations should be at your fingertips. As I said, I'll just zoom this in. This is an executive summary. Um, as you can see, the ones highlighted are the important ones. And as you go ahead in this guideline, you will understand that they have some not bold text as well, and that is just information as to how they have gotten the recommendation. So our main aim is to understand this point. Okay. Now sometimes you don't understand why they are doing that recommendation. Then you can spend 5 minutes as to reading why you want to, the part given below. Now, for example, in this, they usually give, so in chickenpox, they had a update wherein for post exposure, the exposure prophylaxis, they did not give, they were giving immunoglobulin before, varicella immunoglobulin, but they changed it to acyclovir in the recent guideline. And they have given why they do that after 7 to 10 days of the exposure. Okay. Because they said in studies in children have found that it is better when you give it after 7 days or 10 days. Okay. I'm sorry, 14 days, after 14 days. So this has been given in the part which is in the not bold part, but we have already incorporated such things in the GTG lectures. Now, if when you all are reading this and you all have any questions as to why this is happening, you all can completely get in touch with us and we will help you out with that. Okay. Next is, this is something that I always get questions on. If you go to the end of a guideline, you all will find this table. Okay. This table. This is completely not necessary. These questions can only come up in statistics. Whereas in what does grade A mean, grade B mean, grade C mean. When you're reading the guideline, okay, see, this is the strength of the evidence. You see the D here, evidence level 3 and 4. This is the given here, but this is not important to us. They do not ask this in the exam that, okay, this recommendation is this, what is the grade of this recommendation? They have not asked such question till now. Okay. So this box you all need to know, because you'll have to answer questions in statistics regarding this box. But while you're reading the recommendation or learning the recommendation for, let's say, chickenpox in pregnancy, you don't need to remember what level of recommendation was this recommendation. Am I making sense to you? If I'm saying varicella vaccination in pregnancy or postpartum is an option that should be considered for women who are found to have seronegative for varicella zoster. This is recommendation level D. I don't care. Nobody will ask you till now. It's not been asked. So you don't need to remember it with this point that, okay, this is level 10, level D. Okay. But this as a box for statistics as to what is level A, what is grade A, what is grade B, what is the classification of evidence level. This is asked in statistics and research. So this you all need to know for that part. Okay. I hope I have answered this question, because this is a question that is there in every batch of students that we have trained so far. So this at the outset, I want to tell you all that it is not, you all can ignore while reading the GTG. When you're preparing for the exam, you all can ignore it, but you all need to know this box for statistics. So this has to be in your screenshot of important tables, because they sometimes ask what does grade A of recommendation mean, and then you have to mark the correct option. Okay. I hope I'm making sense to you all. Yes, just go through the recommendation. Don't concentrate on these letters in the side. That's a waste. But this box is important. Do not ignore this box, because it is something that they would ask in stats. I hope I'm making myself clear, and give me a thumbs up if you all have understood this. Okay. Thank you. Thank you. You're understanding. I'm glad. Now, as I said, this is just reiteration of what I'm telling you all. You have to practice. You have to read EMQs, SBAs, GTGs, TOGs. Keep revising them. Percentages is something that we will also be helping you in the form of flashcards, but don't break your brains. You all are going to have to keep them written down together, so that when you all revise before the exam, you all can just go through them. The exam is not going to be full of percentages, but some questions here and there would come. As I said, GTG is nice, and TOGs is the main thing that you need to follow. Now, what we are doing what we have been doing for our groups is that we have kept a hybrid, uh, hybrid sessions, wherein due to time constraints, as all of us have different, we are from different time zones. we have busy schedules. We have given you all updated live the recordings of lectures which have been updated and which have been recorded recently by our mentors. Okay. And then we will also be having and incorporating live sessions in the middle. Okay, so that you all can study at your pace, but we will be keeping a check on that through the Telegram live sessions with discussion of MCQs, discussion of some high yielding points with Dr. Sana as well. Okay. Now, this is a question about TOGs. TOGs is something that we have given you all a drive wherein all of these TOGs are also there. I'll show you all a picture. Those who decide to join in with us, you all will be getting that drive, which will have all the TOG sessions, TOG articles. And there are some CPD questions as well. CPD is basically RCOG's way of giving questions on the TOG reviews that have been given there. Okay. So these are those questions. However, not they have not given those answers, so we will be incorporating these CPD questions in our practice sessions as well. How to read talk, you'll have to basically we'll share a talk with you all on the group, on the free group, so you all can understand how it is to be read. Always remember the talk, what do you say, the talk tables have to be revised because most of the questions do come from the tables. Okay. How to utilize this resources, you all will have the recordings which will be module wise. Original guidelines will be there in the drive. The summarized module wise lectures will be given and the questions will be on Telegram. Okay. CPD questions are just questions which are based on TOGs. Okay. That's not it's just what it is called. It's basically continuous professional development, and it's something that is given in every, if any of you all have access to talk, you all can go to their website, and in their volume they will have last CPD questions, and those questions are basically from the reviews that have been given in that particular issue. Okay, so don't get hassled by that. We will be including those questions in the discussion. This is our website, and the website you all will find the modules given in the side, and then you all can go to the lectures. This is the drive that we will be providing to you all, okay, which have been divided depending on the module. We had summarized module wise lecture guidelines, that is, you will have the written material as well. If you don't want to listen to a lecture, you want to listen to the summary, if you want to read the summary of the guideline, you all can do that by accessing it on the internet through our portal. These are the same key areas that we will be covering. And as I said, we've broken down the curriculum into manageable sections. High yielding guideline summaries have been given. There will be consistent revision. So one important thing for you all to, understand is equal amount of participation from y'all, because if y'all don't participate in the Telegram sessions, it's wasted resources. Even if y'all are not prepared, y'all can still come into the session. It's usually 1.5 hours, and it's usually for a feasible time by the end of the day. So most of y'all are, free and can attend. And even if y'all can't attend, y'all can just wake up in the morning and scroll through the Telegram. But when y'all are actively answering, y'all are actively trying to remember what y'all have read. And when y'all try to actively recollect, that is the best way to revise something. Okay, by solving actively in the groups. As we said, we have mentors. I'll be there. We have a couple of other mentors who will be with you throughout the journey. And we'll have Dr. Sana on the Telegram group as well. And I'll also be there on the Telegram groups for you all to help, for me to help you all and answer any doubts or questions. Even throughout the process, if you all want to directly contact us, we have our WhatsApp numbers. You all can contact them. And if we fail to, get back to you all can contact our backend team. They'll definitely help you get in touch with us. Now, I've been wanting to tell you all about a guideline as to, just to acclimatize you all to what GTGs are. An amniocentesis and chorionic villus sampling guideline summary. It's it's 2021 guideline. It's a short and sweet guideline, easy to read. So I'm going to tell you all about this. So we always have in a guideline. So first, before doing this, I want to show you all. Just give me a minute. Okay, can you all see my screen? This is the Green Top guideline on amniocentesis and chorionic villus sampling. It's called GTG number 8. Now, when you all open this page, you all will see this, the heading, who's contributed to it. And you all will see a box. You all can see my screen, right, guys? Yeah. So this was an older way how they were giving. Now the newer guidelines are a little structured, a little different. Um, now this is women who like what we need to tell them. So these are key recommendations. Now key recommendations are points that you all need to know. Here, grade B, grade A, not important. What is important is the recommendation that amniocentesis should not be performed prior to 15 weeks of gestation. So this is we have read the summary. Okay, now we have coming to the aim. It's not important to me. Background, okay, yes, I would read the background because they tell me what is amniocentesis and what is CVS. So the background is important to read. Now, identification and assessment of evidence. They have told us how they have read and what databases they have used. Cochrane database, the MBase, the Medline, PubMed, all of this. This is not important to us. Okay. Who should care? How should we care organized in providing amniocentesis and CVS? Now, this is where our questions start. Okay. Now, this is how the guideline will be given. What are the additional risks associated with invasive testing? So, these points, if you all can see here, I'm sorry, the ones in bold are important to read and to be known. Points given on the side like evidence, quality, strength, not important. Rational, you all can read if you all feel like it because it will not take a lot of time. But this, the column 1 and the last column are important to read. This again, as I told you all, the only RCT, the studies, the trials, we don't need to know that. They are not going to ask me what study was done in 1993. No, they're not. They're going to be asking you, they'll give you a clinical scenario and they'll ask you how you will manage it. For that, we need to know this bold part and this given in the side. Okay. Same way you go down. See, all of this is, most of it is redundant. All of this part is not. Now, this table is another important table. How much percent would require repeat procedure, blood stained samples. This is important. Again, this table is important. Okay. So you, as you all read, you all will understand that these points is confidence interval, 1998 report, these cases, all of this is not what they're going to be asking. What they're asking is this amniocentesis should be performed after 15 weeks. Why? Because if done before, it is associated with an increased risk of talipes equinovirus. Okay. Same goes for CVS. CVS should not be performed before 10 weeks because increased risk of oromandibular and limb defects. This is what you need to know. Am I making sense to you guys? Okay, give me a thumbs up. If you know, you all tell me if you all are understanding what I'm trying to tell you all. Now, this is just a summary for all of you, okay, as to how we would want to read a guideline. When to do, what to do is what they've given, and we have just given these small guidelines in the form of boxes that you all need to know. Some important points that you all need to know. Now, sometimes there are some visual aids that have been given by the RCOG. They can be also helpful in remembering it. Okay. Chorionic villus sampling not performed before 10 weeks. Should be done after 11 weeks. Risk of multiple pregnancies. Bloodborne viruses have to be screened. Viral load and antigen testing should be reviewed before any invasive test is considered. And these are the main key recommendations. Women should be informed about the additional risk of miscarriage. All of these are the key recommendations that you all read in the first part of the guideline that I showed you all. These are the tables that I told you all in the guideline. These are again the smaller tables from down below. What are the risk of women who have HIV? What is the risk in doing invasive testing in them? Again, another table. What training is required? Because this is important to understand as to why when the person doing it has to be, you know, at least had 20 amniocentesis or CVS procedures done annually. So this is what is important and required for you all to learn. not the grade, not the number of studies, not the confidence interval, which will just clutter and cloud your journey towards reading the GTGs and NICE. Same is given in the NICE. TOG, it becomes a little difficult because the whole paper is written like any other review article. Okay, so they will talk about other studies, but therein again, you all will have the tables which will highlight the key information. Apart from giving you all resources, we also give you all mock exams and assessments. So you all can keep on updating you all at the end of the module. You all can give the mock and understand how well you all are doing, or just practice, because practice is what is important in this exam. You can have you all will have the shared a mini schedule on the premium WhatsApp group, and daily EMQs will do a little a little later into the course, because we want to get you all into the limbo of solving questions. So we begin with SBS, so your confidence is building informing SBS. Okay, another important thing is books. So we would also want to we have the PDFs available. The backend team can help you get in touch with the way you all can download these books. While you all are preparing, solving these books can also help you all. Okay, motivation and staying focused is important. Always set long-term goals, celebrate small wins, stay in touch with not only your mentors but also your peers, because that can help in motivation. Another important thing is that you are not alone. We are here with you to help. Whether you join us, you don't join us, it's your call, but we are still here to help those who want help and get you in touch with people who are also studying this exam. You have to believe in yourself, because there are people who might be giving this exam again. That's completely fine. I was for the World Congress in London this when did they happen? The last month in June. And when one of the person was speaking, and they said that they have given the exam 5 times. Okay, the maximum number is, I think, 6. You can't give it more. I think so. I'm not sure, but they had a very high level of giving the exam, and she was a consultant working in the UK right now. So I want you all to remember that it is that maybe we've passed all our exams in the first go till now. We've been brilliant, and we're good students, and that's completely fine. And so this is something that you'll have to accept and not be in denial. So there are people who are preparing again, and it's completely fine. I know so many people who have failed and given it again, but we are here to help you, to hope and to get you through in the first attempt. Okay, self study is important. How much ever we try to teach you all, how much ever we try to make you all revise, if you all are unable to give time to do justice to whatever resources that we're providing, then it becomes redundant. Okay, so having your own motivation to study is very, very important. Those who are giving again, we are here to support you throughout the journey again, but do not feel disheartened. Do not give it with with a stigma in your mind that, okay, I did not clear it in the first time, I'll not be able to do it again. Do not have that stigma. Do not compare your journeys to other people. Everybody has their own story and own journey. Okay, so do not do that. There will be mothers and wives and senior doctors who will be giving this exam. Their life schedule could be completely different from someone who's just passed out, or who's just beginning her career in obstetrics and gynecology, or his or her career. So don't get disheartened. Do not compare. Take baby steps every day to read and revise. This is what we would be providing in the premium course. Another thing that we want is what I was trying to tell you all. This is from Justin Conje, which is one of the books, and this is how a EMQ is given. So this is not the way they give it in the exam. They give it, how in the exam they'll give you this question first. Okay, a 60-year-old postmenopausal woman is seen in the clinic, and then they'll give you these options down. Okay, so you first get to read the question, and then the options come. Now, another thing that you can do is that most of the times the tip that I tell people to answer EMQs is that you all can make up an answer in your mind. That's the first best answer and a second best answer, and then look at your options so that your mind does not get biased towards one particular option. Okay. So what happens is, if you know your GTG nice and talks well, EMQs mainly come from the big guidelines like the venous thromboembolism guideline, the heavy menstrual guideline. So when this happens, when you know the guideline, no amount of confusing options can deter your answer. Okay, so that is why you need to know what is the the right answer through the guideline. Now let's look at this question. A 60-year-old postmenopausal woman is seen in the clinic for follow-up after she had a transvaginal ultrasound scan as a part of the investigation for vague lower abdominal pain. The scan shows a left unilocular simple cyst measuring 45, 35, 50 millimeters. She's otherwise asymptomatic. Now, in postmenopausal women, when you all read the guideline on postmenopausal cysts, anyone who has more than 1 centimeter cyst, you have to assess her by doing what? Would you do a MRI? Would you do an examination? See, all of this I will be doing. I will do a full physical examination. I might need MRI. I might need. I mean, I might need to measure certain, things. I might need to do the staging laparotomy. So all of these answers are correct. But the best next step that we would do is measure our CA 125 level. Correct? So that is your correct answer. It is recommended that ovarian cysts in postmenopausal women should initially be assessed by measuring CA 125 level and transvaginal ultrasound scan. So TVS was already done. So the next best step was to do CA 125. However, all of the other options were also correct. She might need a MRI. She might need a full physical examination. She might need a measure of LDH. She might need a staging laparotomy. But all of these are might need. The best thing that she would right now for us to diagnose whether this is a malignant or not a malignant cyst is to do a CA 125 because epithelial ovarian cancers are more common in that age group. Correct? So I have a few questions now. We have a question. My training will end in mid of October. How can I show my impression of interest at 9th September? By training you mean your masters? Doctor, why don't you do one thing? You can get in touch with our back-end team. We'll help you out with what your question is. Because we're going to have to figure out, yeah, that'll help. That'll be better. If you've cleared the part 1, you can show expression of interest. Assessment of training is only needed for part 3. Part 3, you require 4 years of experience in OBGYN minimum. Okay. Any more questions, guys? I see a few familiar names from my part 1 sessions as well. And I hope all of you all, I know all of you all will clear it and with good colors. Any other questions? Okay. So if you all have any questions, so doctor, so we don't need 4 years experience for part 2. We need 4 years experience for part 3. But I'll still recheck it. I'll ask my team to get in touch with the backend team. They'll recheck it for you and get help you out. Doctor, the amount I'm not the best person to talk would be the backend team, and Dr. Sadhya and Dr. Minhal. They'll help you out with that. Okay. So I'm going to take a leave now, guys. It was really fun interacting with all of you. You have to there has to be a positive quote before we always end the session. You're braver than you believe, stronger than you seem, and smarter than you think. Okay. So dedication, small steps, read, revise, relook is important to pass this exam, pass any exam. It's going to be difficult. You'll feel frustrated. You will be like, why am I wasting my money doing this? But if you've made up your mind, you have to go for the aim. Okay. So take your leave, guys. Bye bye. Nice talking to you.